The Academy began its 5th decade by exerting greater influence in the areas of public health and public policy. Funding from the CDC helped the Academy develop consensus recommendations for adult and pediatric sleep durations. The Board of Directors began approving position statements on topics such as drowsy driving, school start times, and the elimination of daylight saving time. These important documents continued to be published in the Journal of Clinical Sleep Medicine, which was now led by Dr. Nancy Collop as editor-in-chief. The Academy also began investing more resources in JCSM after selling its stake in the journal Sleep to the Sleep Research Society. During this decade, the Academy also had to confront a variety of challenges that were affecting its members.
Well, the major issues are always changing. It seems like the AASM can pick a few things to be proactive about and choose to advance the field in those ways, but a lot of time is spent on putting out fires.
Many payers began implementing prior authorization policies to reduce the use of polysomnography in favor of home sleep apnea tests. CMS repeatedly made cuts to physician reimbursement, more sleep physicians were needed in the field, and consumer sleep technology devices were on the rise. The Academy responded by putting more resources into advocacy, increasing its presence on Capitol Hill, and securing a second seat in the AMA House of Delegates. It implemented a pilot program for novel competency-based sleep medicine fellowship training pathways. It also appointed task forces and committees of experts to address emerging issues such as telemedicine, consumer technology, and artificial intelligence. In the middle of all this activity, the Academy reached a turning point in 2017 when Jerry Barrett retired after 21 years as executive director. He had turned the Academy into a sophisticated and financially sound professional society, and the field of sleep medicine was on solid ground as a medical specialty. As Barrett's successor, the Academy hired Steve Van Hout, a rising leader in the organization who had a background in computer science.
When I took over as executive director, I inherited an amazing organization. Jerry Barrett really put me in a position to hit the ground running.
Van Hout quickly rebranded the Academy and its foundation, focused on creating a welcoming environment for members, and introduced more opportunities for volunteers. His technology-focused initiatives included the first Sleep Medicine Disruptors course in 2019. Disruption became a recurring theme when a global pandemic arrived in 2020.
My feeling is that the Academy and the field has responded admirably under the duress and uncertainty of the evolving worldwide pandemic, and we're stronger for it. And we're thinking a little bit more seriously about how to prepare for the next unforeseen challenge.
One challenge for the Academy and the Sleep Research Society was to quickly transition the Sleep 2020 annual meeting from an in-person event in June to a virtual meeting in August. Adding to this challenge was the news that the Academy's founding president, Dr. William Dement, had died at the age of 91 in June 2020. A special program featuring music and memories was held to honor his legacy during the virtual meeting in August.
The staff worked overtime like crazy to get that done. At the end of the day, it is something very, very proud of, but it was a lot of work during unprecedented times.
The field of sleep medicine experienced another generational challenge when an emergency recall of millions of positive airway pressure devices was announced in June 2021. The Academy responded to the needs of members and their patients while continuing to spread the message that sleep is essential to health. Today, the Academy remains the professional society for sleep physicians from multiple specialties who care for both adult and pediatric patients. It's also the professional home for psychologists and scientists, advanced practice providers and dentists, respiratory therapists, and sleep technologists. Built on the solid foundation of the last 50 years, the Academy and its members will continue to play a leading role in shaping the future of sleep medicine, turning more dreams into reality.
I'm excited about the future of both the field of sleep medicine and the AASM. There's a lot of opportunity out there for us.
The AASM is an incredible organization made up of caring individuals who want to do the best thing to take care of patients and their members.
The AASM is the premier organization of sleep medicine in the US and probably the world.
The AASM is the right organization at the right moment to serve patients, to serve sleep medicine, and to serve the growth of this field.
The AASM is one of the main driving forces behind sleep science and sleep medicine and sleep care for our patients.
The AASM is my home.
Oh, the AASM is my friend.